Good day, I'm Joyce May Escabahog from BSN3E. So for today's video, we are going to demonstrate the nasogastric tube insertion. First things first, we need to assess the doctor's orders, client's level consciousness and level of knowledge and understanding, availability and functionality of the needed materials. Check for history of nasal surgery or deviated septum, assess patency of nares. Determine the presence of gag reflex, and assess mental status or ability to participate in the procedure. For the planning, before inserting a nasogastric tube, determine the size of tube to be inserted and whether the tube is to be attached to suction. Prepare equipment, large or small bore tube, non-allergenic adhesive tape 2.5 cm or 1 inch wide, clean gloves, water-soluble lubricant, facial tissues, glass of water and drinking straw, 20 to 50 ml syringe with an adapter, pH test strip or meter, bilirubin dipstick, stethoscope, disposable pad or towel, clamp or plug, anti-reflux valve for air vent if saline sump tube is used, suction apparatus, safety pin and elastic band, CO2 detector. For the implementation, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do. Good day, ma'am. I'm Joyce May Escabahog, your student nurse for today. May I know your name? Okay. So our procedure for today is we are going to insert a nasogastric tube in your nose. It is a special tube that is used to carry food and medication to the stomach through your nose. So I'll be asking your help for this procedure. Okay? You may kindly raise your hand to give signal if you feel uncomfortable so that may I stop the procedure. Assist the client to a high Fowler's position if his or her health condition permits and support the head on a pillow. Place a towel or disposable pad across the chest. Perform hand hygiene and observe appropriate infection control procedures, example the clean gloves, and provide for client privacy. Assess the client's nares, prepare the tube, and support the patient during the procedure. Determine how far to insert the tube. Use the tube to mark off the distance from the tip of the client's nose to the tip of the earlobe, and then from the tip of the earlobe to the tip of the xiphoid. Mark this length with adhesive tape if the tube does not have markings. Insert the tube. Lubricate the tip of the tube well with water-soluble lubricant or water to ease insertion. Insert the tube with its natural curve toward the client into the selected nostril. Ask the client to hyperextend the neck and gently advance the tube toward the nasopharynx. If the client's gag, stop passing the tube momentarily. Have the client rest, take a few breaths, and take sips of water to calm the gag reflex. Ascertain correct placement of the tube. Aspirate stomach contents and check the pH, which should be acidic. Confirm by X-ray. Place a stethoscope over the client's epigastrium and inject 10 to 30 ml of air into the tube while listening to a whooshing sound. Ensure the tube by taping it to the bridge of the client's nose. For the evaluation and documentation, evaluate the patient response to the procedure, document the procedure and other important data on the client's charts.